Thank you, everyone, and particularly to the Manos clan for having us here, or having me here, and I think everybody can say the same thing. It's a wonderful, fun meeting. So anyway, my task is to talk about whether there's going to be a place for anatomic shoulder replacements in the future. So the answer is yes, there is a place. This one? I think it's this one. Okay. Anyway, if you're from Greece, that's the answer. So I just want to warn anybody that I'm not a visionary, and I wouldn't go to me for any advice on stocks. But anyway, these are my disclosures. Having been here for a few days, particularly the last one has become very problematic. So what do we really want from a shoulder arthroplasty? We want our patients to be happy like this. So they want pain relief, and we want short and long-term good results. They want good range of motion for ADLs. We want good strength. We want to be able to do their hobbies and do their sports. We want these things to last forever with no complications, and we want them to be low maintenance. In other words, easy to put in and easy to take out if necessary. So my personal experience is that anatomic total shoulder in my practice is sort of already on the way out. I find the reverses easier to do. They're quicker to rehab. Patients we give them the option of therapy or not, and we follow them along, but only about 25 to 40% end up getting therapy at all, and they get their motion back on their own. You can also use it for a wide variety of diagnoses, and you can also get reasonable results when using it for revisions, even if you have to revise a reverse itself. And the other thing too is you don't really have to worry about cuff failure, which is really kind of a devastating problem when someone loses their function after just a year or two. So they're very difficult patients. So as a result, there have been increased indications for reverses. We've talked about OA with bone loss and a little bit about proximal humerus fractures. Just about any patient who has a bad rotator cuff, maybe people over the age of 70 or 80 or 90, if they have osteoarthritis but a cuff tear, they're very helpful for that, and you can use it for also just about failed anything, including hemiarthroplasties, totals, and reverses themselves. So my experience generally, this was only back to 2017, but this is the total shoulder arthroplasty rate that we've been using, and you can see that it peaked out around 2007 when we started doing more reverses. This is sort of how my reverse practice has gone. So about 90 to 95% at least is now reverses. And so you can see of the total that reverses have far overtaken standard total shoulder arthroplasty. This is data from Dr. Best at our place, looking at a national database, and that sort of just replicates what we've seen in other studies presented at this meeting, and also from other registries. So what are the advantages of a total shoulder? I think Dr. Dines summarized it very well in that it duplicates more normal anatomy. Patients will say that it's more physiologic. You have to repair the subscapularis routinely, which maybe increases function, but the dysfunction rate with repair, even when they stay repaired, is kind of somewhat not as perfect as we would like. They do get better range of motion, I think, particularly in elevation. And with that increased motion, they can do sports, as Dr. Dines mentioned. And it doesn't seem very important, but for people who have reverses, it's very important to be able to wipe one's behind. And that's certainly not much of an issue, or at least they don't complain about it with the total shoulder arthroplasties. So what are the disadvantages of an anatomic one? There's obvious polywear, which has just been discussed. There's glenoid side loosening. Subscapularis malfunction, I think, is particularly terrible. Subscapularis failure leads to revision, pretty much. Superior escape can occur early. And then there's a question of long-term rotator cuff tear or wear. You know, we know that the natural history of rotator cuff disease is such that they're going to eventually fail. And I've recently had a small group of people who had their anatomics done in the 2005 range who now have no cuff and are looking at revisions. And there is concern about the long-term survival anatomic total shoulder replacement. Maybe the new exciting things that he's talked about in terms of different kinds of fixation or different kinds of surfacing will bring them back to the forefront. So what are the advantages of reverses? They can be used in almost any glenoid. You don't really need a functional rotator cuff. Also, the recovery for patients is much faster with a anatomic, and also sometimes it depends on the prosthesis. I use a prosthesis that has a onlay humeral side, so the rotator, subscapularis rather, you can't fix it back in a large majority of patients, and yet they seem to do pretty well. So what are the disadvantages? Of course, motion improvement is modest. Some patients continue to have pain for no good explanation. You see scapular and acromial fractures have been talked about, and they also have a higher instability rate, which can be a very taxing thing to try to repair or fix. So why are anatomic total shoulder are on the way out? I think the survival rates, though, actually showed around year 15, the survival rates are about the same. One of the bad problems is there's really no good studies with 20-year follow-up from reverses, despite everyone's enthusiasm. Most patients, though, fortunately well, I shouldn't say fortunately, but many patients will outlive their arthroplasty, so I think that particularly doing reverses in patients over 70 or 75, probably they're going to have their arthroplasties for the rest of their lives. And one thing that when we first started doing these back around 2004 or so in the States, one of the biggest concerns that I had was that we would wake up one day and it would be a disaster like the metal on metal total hips. And fortunately, that hasn't come to be the case, but we've managed to get out of it without any disasters. And I think hopefully there aren't any sitting around going to grab us at the 25-year follow-up range. So what are the survivals of an anatomic total shoulder? This study by a group at Mayo, it's interesting that they had a survival rate at minimum 20-year follow-up. The survival rate was only 83%, which means that they had had further surgery, and of course there was another 15 to 20% that had loosening but weren't painful enough where the patients didn't want revisions. So this 83% actually underestimates the survival, or actually the looseness of the failure of the glenoid components or loss of function due to cuff failure at 20 years. And that's a fairly sobering number to think that maybe 60% of total shoulders are functioning well without any loose components. Parsons in this group, also the ones in New York, they reported for survival of anatomic total shoulder arthroplasties. Again, they found 80% at 20 years, which means there's another 20% that are going to fail probably, and all their failures were aseptic loosening of the glenoid, which we know is the weak part of anatomic total shoulder arthroplasty. So what are the survival rates of reverse total shoulder arthroplasties? We know that now. Gerber had one of the longest follow-ups at 9.5 years with some up to 20 years. And they said that significant improvement of overhead function, of subjective and outcome scores up to 20 years after surgery were found. And they also found that there was no significant deterioration between 5 and 20 years of follow-up. So at least it's optimistic, but still we sometimes see failures like the ones shown here where somebody fell and just pretty much destroyed their glenoid side. So Dr. Dines, one of the things that's also come around is that we can make custom components for patients. Many years back, in fact, at this meeting, he announced, or didn't announce it really, but commented that someday every shoulder implant will be custom made for the glenoid side. And that may also be prophetic, but he didn't have the types of implants that were described here earlier at the podium. So what will be the indication for an anatomic total shoulder arthroplasty? It's sort of been alluded to already in this meeting. Younger patients below 55 or 60, maybe 65, those who want to remain athletically active and want to maintain their rotator cuff, particularly if they're going to do weightlifting like this young lady. And I think there also will need to be closer follow-up, because once these get loose, they really do destroy glenoid bone fairly significantly. And I think if we're going to start expecting these to last out 15, 20, 25 years, it'd be nice to get to the loose ones early because the revisions can be a bit of a challenge. So I guess in final conclusions, I think the thing that's interesting to me is the sort of the divide of who gets an anatomic and who gets a reverse. So I want to ask the audience, do you think that there's still a future for anatomic shoulder replacement? How many think that reverses will be the overwhelming, well, it's already the overwhelming prosthesis put in. How many people think that there will be a demise of the anatomic total shoulder? It's a couple, yeah. So we'll see what happens. Thank you very much.